There will be a shift of dollars coming into our clients' clinics that is greater than they've ever imagined. But those dollars are going to decrease the burden financially on the healthcare system.
Just like clients sometimes buy, they'll buy a neuropathy program and it's like a completely different program, different processing of patients. And then they buy a decompression program and then they buy a nutrition program and it's completely different.
Right. And you become kind of like a Kmart of healthcare, if you remember what Kmart is.
I remember Kmart, yes.
What you want to be is you want to
Martha
be the place.
Stewart, she put all her stuff in Kmart.
Yeah. Well,
Yep.
She was the best thing that happened to Kmart.
She was the best thing that happened to Kmart.
Before they went out of business.
I know.
But I'll tell you, the thing you want to be is you want to be the clinic where people go, I have this problem. What can you do for me? And so having the toolbox concept, which is what we promote, and I think we're the only ones who promote this, having that toolbox and saying, okay, let's evaluate the patient, see what they have, see if we can help them, see what tools they would need, come up with a formula for that patient that will encompass those tools to help them get to the goals they want. And that's how we do our businesses. And that little simple concept makes it so much better. Now you don't have this thing happen over here that drains everything from this program.
Exactly, which is the mistake that we made, was putting in fractured programs. Yeah. And that's what AMI systems are as such, that when you put them in, you never have to change how you process a patient through the intake. You never have to change how you ask questions in the consult room with the patient. You don't have to ever change any of that. Look at a hospital system. When a hospital system puts in a whole new program, they don't change how the front desk handles talking to patients. You know how, like, if you've ever been to the hospital, you register, right?
Yep.
They don't change that woman's job. She does the same thing all the time.
She's not sitting there at the front desk going, are you here for a head injury or a heart attack?
I know. Are you here for a heart attack? Are you having a baby? Are you having this? Because I have different paperwork for you. And by the way, we're going to process you differently. But that's what happens.
Right.
And that's what we took that concept, which is, I think earlier you talked about, was it $600 billion? How much is in the
$600 billion in the pain space.
$600 billion in the pain space. And they have it down to a science.
Yeah.
So why don't we just mimic how they process patients, and instead of offering drugs and surgery, offer what's going to get the patient better?
Yeah, natural thing.
That's the aim. If you want to take it down to the simplicity of the AMI system, that's it. We teach you how to do that.
And it's not like we're being a drain on the healthcare system. There will be a shift of dollars coming into our clients' clinics that is greater than they've ever imagined. But those dollars are going to decrease the burden financially on the healthcare system tremendously. So it's going to be a net savings across the board. Insurance has just been a tool to keep an uneven playing field, because if you compare, you can take this opioid and there's a 30% chance you're going to be addicted in 5 days. And there's a 24% of the people who take it are going to still be taking it a year from now because they're addicted to it. You compare that to chiropractic and rehab and just things that we do, you go, who would ever do the opioid?
Well, because they don't present it that way. They say your insurance covers this, and in an hour your pain will be gone.
Yep.
That's what I said.
It's safe. They said that. It's safe. Yeah. It's not going to hurt anything. You're not going to get addicted. Lie.
But understand this. This is the market perception.
Yep.
People want now. They want immediate gratification now. That's 90% of the population who don't go to chiropractic. Patients understand it's going to take a little bit. But remember, we can't change healthcare on 10% of the population.
Right.
To change this space, we need to look at the market that wants instant gratification. So we need to actually process them like they're used to being processed in the hospital and the medical system, give them the experience they expect, yet give them a solution that they don't expect that's going to get them better for good.